Hi everyone, my name is Dinesh Sirasena and I'm a consultant in sports medicine. I use ultrasound regularly in my clinical practice and I wanted to share some of the things that I've learned along the way with you. Today we're going to be talking about ultrasound guided interventions and in particular the consent that we require before we do the procedures. So the things that we're going to be talking about today are the clinical reasoning and confirmation of the type of procedure, the expected outcomes, potential risks, what to expect post-procedure and maybe what to do or not to do, and alternatives to the procedure. Now, it might seem like a little bit of a dry subject, but this is really important when you are counseling your patient prior to the injection and obtaining their informed consent. So this is a typical consent form that you might use in your clinical practice. It was developed through collaboration between nursing and medical colleagues, and it goes through the various aspects and information that the patient might need to know. Let's have a little bit of a closer look at it now. So first and foremost is the name of the procedure and the site of the procedure. It's very important so that the patient is clear of what you're going to be doing, why you're going to be doing it, and it also acts as an aide memoire for you as the clinician prior to undertaking the procedure. Next, we have some generic information about procedures, in particular what to do before the procedure, what it might involve, and what to do afterwards. By laying the information out clearly like this, it not only alleviates stress for the patient, but it also makes it much easier for the clinician when it comes to discussing things with the patient and their relatives. We move on to the benefits of the procedure. And in general, the purpose of doing the procedure may be to reduce the pain, improve their function, or there may be other benefits that you can list here as well. We then consider the possible risks and complications of the procedure. Now, here in the first section, there's some generic complications or risks, such as bleeding, infection, injury to surrounding areas. Maybe the procedure won't be as effective as we hope it will be, or there may be some swelling and tightness following it. After this general information, we can then consider the different treatments that we have available and go into those into a little bit more detail. So for example, next we have the steroid injections. What are the complications that may be associated with a steroid injection? As mentioned in previous videos, there's a number of different ultrasound-guided procedures that can be undertaken for musculoskeletal complaints. This can include not just steroid, but also things like hyaluronic acid, PRP injections, high-volume injections and hydrodilatations, tendon strippings, facet and nerve injections, and so each of these have complications or potential complications listed, and it's useful to have it very clearly written like this. So as you're taking consent, you can go along the list, ticking and crossing out whatever is appropriate or inappropriate to the patient. Finally, we can talk about the alternative options. This might include no treatment, conservative management such as physiotherapy, acupuncture, and alternative therapies, or more interventional treatments such as surgery. It's important to include this here, particularly because some patients may not be keen on the procedure or intervention after listening to the benefits, risks, and side effects of the procedure. It's also important to include it here because then you have done your duty to the patient by informing them what the options are. If they decide to go ahead with the procedure, that's fine, but also if they decide not to go ahead with it, it is really down to their autonomy and you must respect that decision. Finally, we come to signing the form. There's a section here for the patient and also for you as the clinician. One of the things I've learned along the way is if you leave the page and the pen on the work surface for the patient to pick up and then sign, it gives them a final opportunity to ask questions and express any concerns that they may have. It's just a little thing, but I feel that it makes a big difference to the patient, particularly when taking consent prior to a procedure. Well, I hope you enjoyed the video and it adds to your knowledge about ultrasound-guided imaging and procedures, and you can apply this hopefully in your clinical practice. If you did like the video, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram. I hope to see you very soon, and take care. Goodbye.